Dengue fever is a mosquito-borne and primarily an urban disease caused by the dengue RNA virus. This is also sometimes called as dengue fever virus (DENV). The mosquito that is responsible for spread of dengue fever is Aedes aegypti, also known as yellow fever mosquito. This mosquito can be recognized by white markings on its legs. Both Aedes aegypti and Aedes albopictus are the main competent vectors for dengue virus in India. The slums of every city in India are one of the hubs of mosquito breeding, though the epidemiological area of India is very large. For the past 10 years, the number of dengue cases has gradually increased in India. The epidemiology of dengue in India was first reported in Chennai in 1780s, and the first outbreak occurred in Kolkata in 1963. Subsequent outbreaks have been reported in different parts of India. Since 1956, 4 stereotypes of dengue virus have been reported in various parts of the country. The total number of dengue cases has significantly increased in India since 2001. In early 2000s, dengue was endemic in few southern states Maharashtra, Karnataka, Tamil Nadu, and Pondicherry, and some northern states as Delhi, Rajasthan, Haryana, Punjab, and Chandigarh. Subsequently, it has recently spread to many states. Fever Clinic reported 1536 dengue cases during 2012 and 2015, with 61% in 2015 and 23% in 2013. In 2015, Delhi, India recorded its worst outbreak since 2006 with over 15,000 cases. The spike in cases of dengue was the highest in the last decade. According to the data from National Vector-Borne Disease Control Program and National Health Profile 2018, as can be seen in graph, all the states have higher number of cases. In addition to the increased number of cases and disease severity, there has also been a major shift in the geographical range of the disease. Dengue has been restricted to urban areas, but it has now spread to rural areas as well. The expansion of dengue in India has been related to unplanned urbanization, changes in environmental factors, host pathogen interaction, and population immunological factors. Inadequate vector control measures have also created favorable conditions for dengue virus transmission and its mosquito vectors. Temperature and precipitation are important climatic factors in mosquito population and disease transmission. Warm temperatures and high humidity favor increased longevity of the adult mosquitoes and shorten the viral incubation period within the vector and its blood feeding intervals, thus leading to faster virus replication and increased transmission intensity. Apart from this, disposing of solid waste properly and removing artificial man-made habitats are also important. In India, dengue is diagnosed primarily on the basis of clinical manifestations such as high fever, headache, retroorbital pain, myalgia, arthralgia, hemorrhagic manifestations, and also laboratory diagnosis, the test known as McElisa test. The dengue surveillance system in India is a passive surveillance system wherein the dengue cases are diagnosed by public healthcare professionals at different levels. This surveillance is conducted through a network of more than 600 sentinel hospitals under the National Vector-Borne Disease Control Program, the objectives of which are surveillance of disease and outbreaks, early diagnosis and prompt case management, and vector control through community participation and social mobilization. There are, at present, no antiviral drugs for dengue available. However, maintaining proper fluid balance is important and treatment depends on the symptoms. The first dengue vaccine for prevention, Dengvaxia, was made available in Mexico in December 2015. On April 2016, world's first dengue fever vaccine was launched in Philippines. India, Singapore, China, and 9 other countries are trying a second approach aimed at suppressing the population of mosquitoes by releasing only male mosquitoes infected with Wolbachia, which makes the mosquitoes partially resistant to dengue virus. Lastly, International Anti-Dengue Day is observed every year on June 15.